Good day, everyone. Today, my topic of discussion is mandible. That is the only movable bone of the face. I am talking, my mandible is also moving up and down, you will see. Not only during talking, but also during chewing all the food materials, you see. There is the action of the mandible. So, this dynamic mandible, you will see, it is the most movable part of the bone. Other cranial bones you will see and the facial bones, they are fixed. That is the upper jaw, it is fixed. It is not movable. Now this mandible, you will see, it has got a U-shaped portion which is known as the body and a vertical elevation or the vertical projection from the end of the body is known as the ramus, and there are two rami. Now this U-shaped body, it presents an anterior or external surface and an internal surface, you will see here. Now this anterior surface, it midline, you will see the portion, the two halves of the mandible which develops during the mother's womb, they unite and formed a joint which is known as the symphysis menti. That is the symphysial type of joint. And in the external surface you will see the two protuberance which you can feel in your chin here, and this is known as the mental protuberance. Now this mental protuberance is known as chin also. The seniors, they will touch your chin to make you to say the love affection to their children or to their grandchildren. Next is that from this mental protuberance there is an oblique ridge goes upwards and laterally towards the ramus. This oblique ridge, it gives attachment to the muscle. They are known as, in front you will see the muscle is known as the mentalis. I will show you how mentalis is attached. So there is the origin of the mentalis. All of the muscles, mainly it originates from the bone or fascia, and ultimately it is inserted into the skin so that there will be the good facial expression. So this is the attachment of the mentalis. What mentalis do when you have you did not like anything, you will do this thing. So this is the function of the mentalis. Next, from the lateral aspect of the mentalis, another muscle is attached, and this muscle is known as depressor labii inferioris and the depressor anguli oris. That means the angle of the mouth, it depresses like this. So this is the depressor function of the depressor anguli oris. So this depressor anguli oris is also attached here. You will see. Next is that in between the two muscles you will get a foramen. You will see there is a foramen, and the name of the foramen is mental foramen. In the adult you will see this is the adult bone where the mental foramen is situated midway between the upper border which is known as the alveolar border and the lower border which is known as the base of the mandible. So in between the two, but this position of this mental foramen, it changes from birth up to the old age. That we'll discuss later on. Now you will see this mental foramen transmits a nerve which is known as the mental nerve. So this is the external surface. Next, the internal surface of the body. You will see the internal surface, this is more or less smooth. In the middle there is a line. You will see this line descends downwards and medially from an elevated mass, and this line is known as the myelohide line. So this myelohide, it gives attachment to the myelohide muscle, which forms the floor of the mouth. You see, this is the floor of the mouth. So the person which chews more, their floor of the mouth is strong, there will be no double chin. Nowadays the kids and the other person, they also very much used to take the soft food, and you will see they possess the double chin in their younger age group. So this is the myelohide line, and you will see, so this line divides the areas into two parts. The upper part, this is known as the sublingual fossa. That means our tongue. Beneath the tongue, the fossa is situated, and this fossa is known as the submandibular fossa. The two salivary gland is situated here. This is the sublingual glands on either side, and the submandibular salivary gland on the, actually you see the medial aspect of the ramus and also the body of the mandible. So you will see the three glands are associated, salivary gland are associated with the mandible, and they pour their secretion underneath the tongue, as well as the parotid gland, which is secreted outside in the ramus. It will secrete by the parotid duct into the mouth, in the vestibule of the mouth, opposite the upper second molar teeth. So you will see, so these are the feature you will see on the inner aspect. Now in the inner aspect, in the midline, you will see small elevated structure. They are known as the genial tubercle. And this genial tubercle, in some bone, it divides into 4 small species. So they are divided into upper genial tubercle and the lower genial tubercle. And this upper genial tubercle gives attachment to a muscle which is known as the Geniohyoid, which I shall show in the dissection. You see the specimen of head, neck and brain, the sagittal section. So this is the Geniohyoid. So genioglossus and the geniohyoid, this goes below to attach in the hyoid bone, which you can feel here at the base of the floor of the mouth. So this geniohyoid is known as the safety muscle of the tongue, because this prevents the fall back of the tongue during the senseless position. This is the geniohyoid muscle. Next, you will see behind this myelohide line, there is a foramen. You will see this is the foramen. This foramen is known as the mandibular foramen. It goes to a canal, and this mandibular foramen transmits a nerve which is known as the inferior dental branch of the, or inferior alveolar branch of the mandibular nerve. So you see, this is the mandibular foramen. You can see all this. So, and this mandibular foramen is guarded medially by means of a projection, and this projection is known as the lingula of the mandible. And here a ligament is attached, which is known as the sphenomandibular ligament. So this is, you see, I will show you this nerve transmit through here, the inferior alveolar nerve. I show you another real feature. You will see this is the cut section of the mandible. This is done by class 4 attendant staff, the dissection attendant staff. Here you will see the lower part, you will see the artery, and you will see the inferior dental nerve. And this nerve supplies the root, and by which you can get pain if there is any dental caries. So nowadays, previously there is a treatment to remove the teeth But nowadays, due to advancement of the dental surgery, you will see there is a treatment which is known as the root canal treatment. Here you will see this is the molar teeth, and this molar teeth has got this root, and there is a small canal within. So they block this nerve by means of a screw. This paralyzes this nerve, not paralyzed, this blocked. This region is blocked so that pain sensation is not felt. So here teeth is there, but there is no pain sensation. So you will see this superior border or the alveolar border in the adult is contain more or less 16 teeth. You will see in the whole of the lower jaw, and in the upper jaw the 16 teeth is there. So always there will not be 16 teeth. Sometimes there is eruption of the third molar teeth is not there. So there may be 14 or 15 teeth also present. So this is the alveolar surface. Along the upper border of the alveolar surface, this region, there is attachment, linear origin of a muscle which is known as the Vaccinator muscle from the three molar teeth from it outside. So this is the origin of the Vaccinator, which is attached on both sides. So I will show you, this is the Vaccinator, and Vaccinator muscle, you can in the mouth, you see, you feel here, this muscle is the Vaccinator muscle, and this muscle you will see, if you blow your mouth like this, the Vaccinator holds the air within the mouth. So this is the function of the Vaccinator, and if there is facial nerve paralysis, what will happen? You can taste this one, that you will see the air will come out. One cannot do this type of swelling, air within the mouth. So this is a test of the facial nerve paralysis. So the Vaccinator you will see here. Now come to the ramus of the mandible. So you will see this is the ramus of the mandible. In the lower border, which is known as the base, it unites with the ramus and forms the angle of the mandible. This is very important because you can see the sex difference between the mandible. If you can get, in the forensic person get a mandible, so they can identify. You will see in case of male, this angle is everted. You feel in this region, you see this angle is everted. That's why male looks more tougher than the female. So now this angle of the mandible, over here there is attachment of a muscle, that is one of the muscles of mastication. You see, this is the masseter. This is the insertion of the masseter. You clench your teeth, upper jaw with lower jaw, you close it, and you can feel this is the masseter. This is very important muscle. You will see, and during extraction of the wisdom teeth, sometimes there is a problem in the masseter, and then there will be opening of the mouth will be reduced, and you should do the physiotherapy for that region. So this is the, you see, the external surface or the outer surface of the ramus. Now this ramus in the upper part divides into two. The upper part, you will see the ramus of the mandible divides into two processes. The posterior one is known as the condyloid process. It is transversely broad, and anterior one is pointed and known as the coronoid process. Now this condyloid process, it articulates with a fossa that is situated under surface of a bone which is known as the temporal bone, this bone, and this is fossa is known as the mandibular fossa. So you see a joint is formed. You see the joint is formed, and this joint is known as the Temporomandibular joint. That is the very important joint in our body. Not only in function, in case of yawning, you see yawning means that is a long type of yawning, and at that time there may be the dislocation of the mandible, or somebody they punch in this region, there may be the dislocation of the mandible. So you will see, so this temporomandibular joint, that is the synovial variety, subtype is the condyloid variety of joint, and below that there is a depression, and this depression gives insertion to a muscle which is known as the lateral pterygoid. You see here there is the attachment of the lateral pterygoid muscle. This lateral pterygoid produces the side to side movement of the temporomandibular joint. Next is another muscle is attached here, that is at the tip of the coronoid process at the anterior border. The name of the muscle is temporalis. You can feel when you have got the headache, you will see if you press in this region, if you clench your teeth, you will see some muscle is moving, and this is the temporalis muscle, and that is inserted in this region. So these are also the muscles of mastication. Now this is the masseteric notch, the notch between the condyloid and the coronoid process. So this is about the mandible. Now you should know about the age changes of the mandible. Now when we born, you see when there is no teeth in our mouth, at that time what you will see? You will see there is this mental foramen is in this region. This is the region of here. Now gradually when there is formation of adult, this alveolar ridge increases, the formation of teeth is there, it is in the midline position, and this angle is vertical. Next, when the teeth is falling, so in this case you see right sided teeth is present, so no reabsorption of this gum. But where the teeth is absent, the absorption of the gum takes place. So gradually the mental foramen you will see becomes upwards, not in the middle. Here you see it is in the middle, but here you will see here it is on the upper border near the. Next, when whole of the teeth you see it has fallen, particularly you can see not in the city but in the villages, because nowadays the city people they will use false teeth. You will see here there is no teeth. So what will happen? You will see this mental foramen is in the upper border. So this is the changes of the mandible. So thank you everybody for watching this video, and please give a channel comment so that I can understand what is the drawback and what is the beneficial video for you or not.